Welcome to the office.
So initial injury for your back was playing badminton in high school years ago, right? You dealt with it, you kind of went through it, high pain threshold, went through college, learned more about chiropractic after college. We fast forward, we have a snowboarding injury. Did you feel the back also, or the back didn't really bother you after that snowboarding injury?
I don't think the back was bothering.
Okay, so left knee, neck.
Neck, yeah.
Tell me about the neck.
Neck, there's just constant pain now in like this area.
Like a sharp pain, a tight
dull.
pain, dull.
Yeah, it's
Okay.
just always there.
And end of the day, it starts to get tight.
Not even like at the end of the day. It will be
Midday?
Midday.
You wake up in the morning, things are stiff.
Yeah.
And it takes you how long before things unstiffen?
Like anywhere, like
An hour?
I shower in the morning, so like after I shower, usually
Everything loosens up?
yeah, loosens up a little bit. But then yeah, I do wake up in the morning and like my shoulder and neck area is just very stiff.
Okay.
And my back, like I always just crack my back first thing I wake up in the morning.
Okay. And I'm going to show you why.
Okay.
I'll show you all that today. Okay. What else? So we have low back, we have left knee, we have neck.
And then a year ago, my tailbone started hurting.
Okay.
I don't know why.
Fall.
I don't remember having a fall. I think it just like came out of nowhere.
Dead center, left, right side.
Center.
Center.
Yeah, and especially when I'm sitting for a prolonged period of time.
Sure.
So in the beginning, like it would be so painful that when like I stand up, I couldn't like stand up right away. Like I had to wait a little bit and then like gradually stand up. So I went to see doctors about it. Like my doctor, she pretty much prescribed me anti-inflammatory like medicine.
Sure. Okay.
So I did that for a while, and then the pain is not that sharp.
As long as you're taking the meds, or you're not taking
No,
the meds?
I'm not taking the meds anymore. So like
Okay.
the pain, it's
Minimal, but it's there.
yeah, it's still there,
Okay. Does it flare up from something?
just from sitting.
So sitting an hour, 40 minutes, 10 minutes?
Like more like an hour.
Okay. Is there anything else before I have you walk? Digestion. Sleep, you said is okay.
Sleep is fine, I think.
Anything waking you up in the middle of the night?
Not really.
Okay, so you're able to sleep
I'm
through
able
the
to
night.
sleep through.
So, what can I do for you? What do you want out of this experience? What are you here for? You're here for me to give you the answers, or to give you the answers and fix it at the same time?
Yes, that please.
Yes. So I think the main thing is, and as you came in through watching as well, right?
Yeah.
And the idea is figuring out what it is, and once we figure it out, it's easy. Okay. But we got to figure it out. So I'm gonna have you walk next, and we've seen we're gonna walk a straight line back and forth. So the first thing you're gonna see is the walk is not very. It's a little. There's a lot of imbalance in her walk. Keep walking, please. So, yeah, this is starting in the low back. Turn around, please, and march in place. So I want you to see what's going on here. What we're gonna see is, I don't really see this right dimple. I see the left dimple, but not the right. Now as she walks, you're gonna see it kind of goes side to side instead of up and down. Walk away from us now, please. So the pelvis is shifting sideways. It's not getting this movement. You're not getting this type of motion, normal motion of the pelvis. Something is stuck in there causing you to, lack of a better term, you're waddling side to side. So you walk in like this. I'm exaggerating it, okay? So it looks a little funny. So it's like,
Yeah, I do feel that when I'm walking.
and this is doing side to side, not up and down.
Okay.
Okay, keep going, please. And then that right foot flares out when she's doing that. And then it wants to pronate on that side. Okay, and we said it was the left knee.
Left knee.
Can you raise the gown just a little bit so I can see the knee and keep walking? And now as she walks, that left knee wants to internally rotate. Every time it's internally rotating. So the question is it actually the femur, the tibia, or is all of this coming from the sacrum or pelvis? That's what we need to figure out. Okay, keep going. One more. Yeah. Then the other thing, you watch that right pinky toe. Just watch that right pinky toe the whole way. And so what's happening is there's a lot of compensation in your right foot.
Okay.
Not so much in, that's what's interesting, your left knee, but it's causing a lot of compensation in your right ankle and right foot. Come back over here, young lady, let's get started. You ready?
Yes.
Let's do it, have a seat. So let's look. First of all, there's no curve in her spine. This is flat, okay? This is how I need you to be. This is gonna be your norm, okay? How does that feel to sit like that right now?
It's very tiring.
Very tiring here, or all of it?
Like right here.
In the mid, okay. So this is how she should sit. Now sit how you normally sit. So there's no curve in through here. Little dishing going on through here. You can see she carries a lot of stuff on her shoulders, more on the right side. Energetically, she carries too much work stuff with her everywhere she goes. You're carrying it all here, by the way. And I'm not even getting into your work stuff right now. That doesn't look right to me. That tissue change is different. This area controls, there's some adrenal and kidney control there, okay? In this area. This area is digestion. This spot doesn't look right. This spot doesn't look right. This spot doesn't look right to me. This area way up top here is going to be more heart, lungs. This area is going to be more digestion. This area is going to be more adrenals and energy. But all of it starts where? We need a foundation, don't we? Okay, this is how we need to be. Now, let's go ahead and run the meter. Relax the spine back to where it was. Okay. Goes up like this to the left. Comes back all the way through. Let's run the meter, see what's going on. Alrighty. So, starting at the base of the neck. We got a 15-point reading around C6. Top right atlas, 15. T5, T6, 12 to 15. You already knew this stuff though, didn't you? All of it. So it doesn't mean I'm adjusting all these spots today, okay? It means it's gonna be one, maybe all of them, but we'll gotta make some clinical decisions of where we're gonna start today for you to give you the best result. Okay. So what's interesting is it's right-sided is tight, but the pressures are all on her left side.
I feel everything on my left side.
Yeah. And all your pressure readings are on your left side. That's interesting. You're pretty red on the scope. Head down, please. I do definitely need you drinking more water. Okay. I'm going through static palpation right now. Breathe, breathe. There we go. And you can see, as soon as I start here, tissue changes. Red, orange peel right to there, and then it sucks in here. That's tender.
Mm-hmm.
That's more tender.
No, the first one.
That's tender. Yeah. 1, 2, 3, 4, T5, 6, 7, 8, 9, 10, 11, 12. 12 more tender or 11 more tender?
12.
12 more tender or 1 more tender?
12.
12. Scoot forward, please. Feet together, knees open and close. Open. There you go. Right side only. Open wide, please. There you go. Good. Left side only. Interesting. Right side. So when you do the right side, okay, what I'm feeling is the left goes with it, like that. When you do the left side, though, right moves a little, but it's not going with it. Do you feel that? Okay, scoot back for me, please. Now I want to motion the joint, top of the joint, top of the right joint, middle, left. It's a little tight on the top here, but it is moving, okay? Other side. That thing's not moving. You feel that all there? Yeah. That's a PIEX. That's the pelvis. This is S1. This is L5. Right there. More tender at S2, more tender at S. I feel that one.
Mm-hmm.
How's L5?
One is okay.
S1 is the most tender? Yeah. S1, left pelvis, T12, T5. Now let's go to the top, okay?
Mm-hmm.
Let's look at this. We're designed to have 60-degree reciprocating curves. 60, 60, 60. That's the way we're designed. And that is our primary line of defense against gravity to protect our nervous system.
Mm-hmm.
Okay? You may have heard me talk about some of this stuff. Yeah? This is the front, this is the back. So the idea is we want to get as close to those 60-degree curves. We have a straight starting the reversal here. We're straight through here. We're straight. So we have no curvature that we need. And so what's going to happen, anytime there's loads put on the body, something is going to take it on, right? Because we don't have those curves. And I want to talk real briefly about the spinal defense mechanisms. This is really important. I've gone over it in other videos. I don't know how in depth I went though. Have you heard about the spinal defense mechanism?
No.
SDM. Okay. Our first line of defense we said is spinal curve.
Right.
How do we lose the curve? 2 ways. Macro or micro traumas. Macros, that's the slips, falls, accidents.
Mm-hmm.
Micro, those are the postural ones. Those are the repetitive strains. Okay? For whatever reason we lose the curve as we have, we're going to talk about what happens next. Second defense is the muscular system. Muscles in regards to defense will start to spasm areas that are not stable. So we already know we've had spasms here. We already know we've had those spasms, yeah?
Yeah.
Spasms are energetically very expensive. So the body's going to do what? Again, it's all about stabilizing.
Mm-hmm.
So we lost the curve, muscle spasms. Eventually it's going to get tired. It's energetically expensive. The third system is the ligamentous system. The function of a ligament is to connect bones. Okay? Now, let's say the bone is supposed to be like this, bone, disc, bone. Let's say it's out of alignment or in the wrong position for a period of time.
Mm-hmm.
Those ligaments remodel, they shorten. Okay? Some people say scar tissue, some people say shortened ligament, whatever it is. The point is when those ligaments shorten, now, let's take L5 as an example. So L5 goes back a little, the ligaments in the back shorten after a period of time. I wake up in the morning and I'm trying to stretch, but it's tight. We got to open it up. Same thing here. That's the ligament. That's that morning stiffness we were talking about earlier. Okay? That's not muscle. That's ligament.
Okay.
This is where scar tissue forms. This is where, that's that tight feel. Okay. Fourth system is the disc. Now, the disc is called the great ligament of the spine. It connects the two bones. Two parts of the disc. We have a nucleus, which is like, think of this like a pivotal ball bearing, right? We have the annulus that holds the ball bearing in place.
Okay.
The ball bearing, it's a pivot. It allows 6 degrees of motion.
I see.
Okay, when we slip, fall, posture, life, things are going out, things are coming back, going out, coming back. Yep. But the time it stays out is when this process happens. Okay, now let's say it misaligned. It misaligns, it's not sitting on the pivot. We're gonna lose 1 or all 6 degrees of motion. If we lose motion in the disc is called the synovial joint. Have you heard that term before? Synovial joint, our hands, our knees, our feet, means that there's not a direct nerve and blood supply there. There's a little sac that lines it, a little fluid. Okay. And the way these joints get nutrition, hydration, and get rid of waste products is through movement. You've heard the saying, move it or lose it. If you don't move it, it stiffens up. Right. That's characteristic of a synovial joint. Now, follow my thought process. Okay. We lost motion, okay, because of a misalignment. Because we're not sitting on the ball bearing. Second thing is, the body's going to want to do what? Compensate. It's going to want to compensate. But before we even get to that, it misaligns. The disc will start to swell, irritates the nerve. Wherever that nerve goes, there's less function. Now, if it's not moving, we lose the process of imbibition. Imbibition means like to imbibe, to bring in. Imbibition is the process in the synovial joint to bring in the nutrition and hydration to get rid of waste products. That only happens through motion. Right. Okay? The point of it is, if we lose motion, we degenerate. We wear out faster. The 5th system is the osseous. And this is where the body lays down calcium. That's where arthritis comes from. Okay? These are the defenses. So we have a loss of curve. Right. Okay? We have the spasms. We have the ligaments. Do we have any worn out discs that are significant? You have great discs going through here, okay? So these are fine, these are fine. 1 or 2 maybe a little less, especially in this area. You got a nice kink in here. Right. We're going to talk about that a little bit later, okay? But so as we're going through the discs, overall your discs are great. I have a couple that are a little less than normal, but when I say less, maybe 10%. Okay? Here's what's misleading. You have a straight spine. And typically with a straight spine, that's usually from an AS pelvis, a pelvis that has gone up. But yours has actually gone down. So this was going to be an interesting case. I'm not joking. This straightening of the spine usually comes from a misaligned pelvis up. Yours is misaligned down. So there's something else we need to figure out. There's your tailbone that's hurting you. Yes. Now, it's very subtle in here. That's that piece, but then something is not right here. So this is it's bent this way. We need to bring it back out. I'm not going to work on the tailbone until I get the pressure off here for you. Otherwise, none of that's going to hold. So, bring this all together. You have no curve. You're sitting on your butt, your tailbone. There's nothing protecting gravity. What's taking up all the slack? Does that make sense? Because there's no curve. Yeah. You get curve in there, what happens? It's going to be able to balance those forces of gravity. Okay? And we'll see after today's adjustment. Any questions on that only?
No.
Okay. Yeah. So good news, we have a level base. We have the left pelvis is out. We're going to continue the exam to see where we're going to start. And let's get started. Okay? And again, along the way, if there's any questions, just stop me.
Okay.
We're going to start left atlas, and we're going to start on the L5. And then I'm going to recheck everything for you, okay?
Okay.
Let's go on the orange table, please. We're gonna do left atlas, ASL. Gotcha. Face down, please. You okay? A little tender. Let's get more of the atlas. Left hand up. I'm putting a seat belt on to hold everything in place. Move on to the knee chest. You're doing good?
Mm-hmm.
Okay. There you go. You good with that?
Mm-hmm.
Okay. Chin up. Hands here. And we're gonna do T5 first. Chin up, please. Hold breath. Tummy up slowly. And just let it hang down, all the way down. Down, down, there you go. I'm gonna place my knee right on your left glute. That's to stabilize your pelvis, okay?
Oh.
Gotcha. That's it. Hold on. You got a nice sweat from that. Come up slowly and walk it off, and then you can tell us what's different, okay? Take your time.
My ankles feel better.
Yeah, you're not wobbling.
The neck pain is, I don't feel it now.
Back over here, let's recheck everything and see what happened, okay? Okay. We're good. We're clear. T12 should be clear. Okay. All clear, lady.
Awesome.
Let's do the shoulders and tune most of you up, okay? That's where we're going to start today.
All right.
Let's go ahead and do your shoulders. Hoi. Oh. Hoi. That's it. Go on your back here, please. I'm going to do left ankle, left tibia. Sound is the board, okay? Not you. There you go. Stand up for me, please. Do the hands. Questions?
Oh.
Wait.
No, I feel lighter.
Okay, you want to walk a little bit more still? Let's watch. You remember which toe I told you to focus on?
Right.
So it was doing this. Every time you walk, it's like totally going up like that.
Yeah.
Your right pinky.
Oh, is it?
Yeah. It's not doing that anymore. It goes up a little bit. And I'm going to need to work on a few other things on the foot down the road. But other than that, that's where we're going to start, lady. The goal, I'll see you a couple visits.
Mm-hmm.
In those couple more visits, we're figuring out frequency and what the meter's going to tell us down the road and what's moving down the road.
Mm-hmm.
Okay, from there, we'll make some decisions. I'll tell you what I can fix, what I can manage. You tell me what you want from there.
Okay.
Fair enough?
Yeah.
Welcome to the office.